Hello and welcome to the next episode of the Explain series with your host, Dr. Bret Palmer. Today we're going to be talking about Peyronie's disease. Now, Peyronie's disease is a disease where you have scar tissue forming under the skin of the penis, and as the scar tissue gets longer and gets thicker, it starts to pull all the other tissues around it, and so the penis itself actually starts to bend towards the scar tissue. And you have two forms of Peyronie's disease. You either have it acute or chronic. And in the acute phase, that tends to be the aggressive phase, where it can be at its most painful, and the plaque formation is quite tough and can be quite fast, happening over a number of weeks, and you can have quite an alarming bend. And I've seen people with a right-angled penis, and it can be very, very painful, and it can also stop you from having sexual intercourse as well because of the pain, and sometimes just physically impossible to have sex. So what do you do? So you need to go to either a sexual health doctor, or ideally you need to go to a urologist. Okay, so this is a disorder we do see in sexual health clinics here in the UK, but we tend to pinpoint them and direct them to urologists. The urologist will examine your penis flaccid. They may give you an injection in the penis to give you an erection. What they may do, and I've heard both of these things happen, if the patient turns down the injection, or the doctor doesn't particularly want to do the injection, they may turn around and say, well, go home, take a few photos if you haven't already, and then I'll examine the penis through the photos to see how bad the curvature is. Now, the acute phase itself can last up to 12 to 18 months and tends to be, as I said, the time of most pain and discomfort. And then after 12 or 18 months, you then get into a chronic phase. Now, in the chronic phase, sometimes the scar tissue can actually start to relax a little bit, and it can start to return a little bit to normal, and the pain can sometimes subside. And the vast majority of Peyronie's disease, and you have to remember this is a very common disease. I've seen some papers which say it's 1 in 100. Some people say it's 10% of guys that have some form of Peyronie's disease, but the vast majority of individuals don't need any treatment whatsoever. Yeah, they've got a bit of a curve, so what? Who hasn't got a curve? But it's not really painful. They may be able to feel a bit of a hard lump under the penis, but apart from that, there's nothing to do, in which case then you just carry on through life. But for those individuals who are in the chronic phase and it's really, really starting to get them down, and they can't have sex, it's destroying their relationship and it's painful, then you need to move on to what can be done next. And so there's non-medical treatment, medical treatment and surgical treatment. In non-medical treatment, it's effectively watch and wait, sometimes stretching exercises, and see what happens. With the medical treatment, there are injections which help dissolve the plaque, but you can also use verapamil, which are blood pressure medication as well, and that all help to reduce the pain. There's also painkillers as well. And for surgical treatments, there can be grafting, where you take skin from one area and put it on the other. There can be something called piculation, where you take the penis which is curving, you pinch on the other side to help straighten the penis up, but obviously this itself can shorten the penis length, and sometimes you also lose a little bit of girth on the penis. And there's also implants, and putting a penile implant can obviously there to stop erectile dysfunction, and can also lengthen the penis as well to get rid of the actual scar tissue. Well, what are the risk factors for Peyronie's disease? Well, diabetes, people who have autoimmune disorders, trauma to the penis, and so incredibly vigorous sex causing trauma to the penis can later on lead on to Peyronie's disease, and also people who have Dupuytren's contracture, which is contracture of the fascia in the hand, or fasciitis in the feet. Can also those individuals can also have end up having a little bit of Peyronie's disease as well. At the end of the day, the actual cause as to why someone may have Peyronie's disease and someone may not. We don't know. There may be a genetic component, so if your father has it, then there's a chance that you may get it, but that's not guaranteed. And as we don't know the exact cause of Peyronie's disease, we don't know the exact cure. And so there's lots of research and there's quite a few trials into different methods of trying to resolve Peyronie's disease. Hope you enjoyed this episode and see you in the next one. Take care.